hyperemia, both hyperemia and congestion are the result of excessive blood in a part of the body. Excessive blood by a microscope we can see like a congestion or hyperemia. They differ from hemorrhage in that with hyperemia and congestion, the blood is still confined within the vasculature. In hemorrhage, the blood cells has escaped from the blood vessels and are in the stomach. Hyperemia is an active process due to arteriolar dilation, which leads to increased blood flow at sites of inflammation or in skeletal muscle during exercise. Congestion is due to obstruction of venous return and therefore is a passive process. It can be systemic as in cardiac failure or localized as in isolated venous obstruction.
Anna, what is meant by active process and passive process in this? What is meant by active process and passive process?
Hyperemia and congestion.
For example, sometimes we have blood flow, we have increasing blood flow because we are sitting down and our foot is lower. Okay, this is inactive. But sometimes the blood flow increase because of exercise. This is active process. This is difference between these two. Sometimes congestion is because of active process like exercise, and sometimes it's not active because of the position, for example.
बताओ मैंने भी समझाओ
कैंसर पे चल रहा है मेरे दिमाग अभी तक सच में
मेरा आज
Congestion normally leads to edema due to leak of fluid from blood vessels. A small hemorrhagic foci due to capillary rupture also can be seen in the chronic congestion. Microscopic features of congestion. You can see the capillary and vein that are engorged with blood. Excessive clusters of hemocytrin-laden macrophages in tissue medicine. Hemocytrin-laden macrophages are some macrophages with some golden brown pigment in their cytoplasm. In long-standing chronic passive congestion, the lack of blood flow causes ischemic tissue injury and scarring. In our slides, the kidney tissue, I think the kidney tissue is seen, or sometimes any tissue with congestion and hyperemia we can see. And we see the blood vessels that are dilated and congested. So we have the blood vessels, capillary size, that they are very enlarged and dilated. And some area of a small hemorrhage. Hemorrhage means that we have some blood vessels outside, yes, outside the capillary and the veins. Here you can see these blood vessels and the accumulation of RBC and other blood vessels in this area, and also this area are capillary sized vessels. This is a kidney tissue in this slide. This is a glomerule and this is a tube of kidney, but I think that today's slide is from skin, congestion of the skin tissue.
How can we differentiate on slide between hyperemia and congestion?
We don't need to differentiate these two. They are different only in physiologic and but in the by microscope we see both cells. But hemorrhage is different from hyperemia and congestion. Here you can see kidney tissue. This is glomerule of kidney and tubule of kidney and accumulation of RBC in the vessels. Again here this structure is a capillary and is a blood vessels with accumulation of many RBC in this area.
And now, how can we differentiate hemorrhage and congestion?
Hemorrhage from congestion, yes. Hemorrhage,
Outside the blood.
all of these RBC are outside the blood vessels in hemorrhage. But in congestion and hyperemia, we see this RBC inside the vessels, sometimes with a small foci of hemorrhage like this area. This brown pigment are for hemocysteine-laden macrophages. Okay, this is congestion. But in hemorrhage, we have only free blood vessels in the tissue.
There is no boundary of vessel in this slide.
Yes, this is the endothelium of vessel. This is okay.
But there is blood outside the vessel also.
Which one? This.
Yes.
This again is entire this vessel. This is entire this. This is entire this vessel. Yes. Yes, maybe this is not clear. This picture is not clear. But all of these are vessels.
Hyperemia
Okay.
is congestion
And you can see that these RBC are in a structure. When we have hemorrhage, they are not confined to an area. In thrombosis,
राहत की क्या हो गया
three primary abnormalities that lead to thrombus formation include endothelial injury, stasis or turbulent blood flow, and hypercoagulability of blood. Thrombi can develop anywhere in the cardiovascular system, in cardiac, or in capillary. The size and shape of thrombi depend on the site of origin and the cause of the thrombus formation. Arterial or cardiac thrombi usually begin at site of turbulence or endothelial injury, but venous thrombi characteristically occur at the site of stasis.
So, when I understood, when recording, why don't you understand? Say, Azan hai.
Microscopic examination.
Azan wali lines of Azan.
In our slides, a large vessel can be seen. So you see a large vessel. The lumen of vessel is filled with a thrombus which is focally attached to the underlying vascular surface. Organization of thrombus with fibrous connective tissue and formation of a small new blood vessels, or we call this recanalization is evident. Eventually, with remodeling and contraction of the mesenchymal element, only a lump with endothelial lining may be seen inside the lumen, and we call it fibrous lump. Here, what's this? This large structure is a vessel wall, and this structure inside this is thrombus, and in an area, in this area, this is attached to the vessel wall. Here again, this structure, this large structure is a vessel wall, and this is a thrombus, and in this area, this is attached to the vessel wall. Again, here with low power, this is a vessel, this is a vessel wall, and this structure, this pink structure that is very low cellular and composed of fibrin material and coagulatory material in this area is thrombus formation. Again, here, this is thrombus. We said that sometimes this start to organize and some spindle cells, some proliferation of spindle fibroblastic cells is here, and you can see the fibrous lump here. Here, what's this? It's a recanalization of thrombus. Okay, this structure is a thrombus formation, and here we have formation of some small blood vessels for starting blood flow again. About infarction.
No, man, no, I don't know.
An infarct is an area of ischemic necrosis caused by occlusion of either the arterial supply or the venous drainage. 40% of all deaths in United States are caused by cardiovascular disease, and most of these are attributable to myocardial or cerebral infarction. Nearly all infarcts result from thrombotic or embolic arterial occlusion in organs with only one drainage vein, such as testis or ovary. Venous obstruction can cause infarction. Infarcts are classified according to color and the presence or absence of infection. We have red infarct, white infarct, septic infarct, and aseptic infarct. Red infarct occurs with venous occlusion, for example in ovary, in loose tissue, for example in lung, and in tissue with dual circulation like lung and small intestine. White infarcts occur with arterial occlusion in solid organ with end arterial circulation like heart, spleen, and kidney. So, white infarction are in tissue with arterial occlusion, for example in heart, spleen, and kidney, and red infarction is because of venous occlusion in loose tissue and in tissue with dual circulation.
Why venous obstruction is causing infarction? Is oxygenated blood is supplied by artery?
By what? By venous. By venous obstruction. The dominant histology characteristic of infarction is ischemic coagulative necrosis, except in the brain, which is liquefactive necrosis. Acute inflammation is present along the margin of infarct within a few hours. Gradually, necrotic material is digested by macrophages and neutrophils. Eventually, the necrotic tissue will be replaced by scar. Full recovery with the original tissue is rarely seen. In our slide, liver or spleen tissue is seen. In a focal area, there is a pale region, which in higher power looks necrosis. In other area, inflammation and scar formation is present. This is a spleen infarction. This is normal. Here is normal spleen tissue, and here is necrotic tissue because of infarction.
Is white infarction?
Yes, in spleen and in solid tissue is white. And here in high power, you can see that the cells are die and some inflammatory cells accumulate here. But here is the normal viable tissue. Again, here you can see the infarcted necrotic area. This is heart infarction. In heart tissue, the normal cells are myocyte. Okay, myocyte, and in some area we can see that this myocyte has damaged nuclei, or in some area there is no nuclei because of the infarction and necrosis. These are blood vessels, red blood cells in this area because of hemorrhage, and these dark blue cells are leukocytes and inflammatory cells, and the other cells are myocytes that in some area there is no nuclei because of the infarction. Here you can see the myocytes, here myocytes and some other inflammatory cells between them. And here you can see some myocytes without any nuclei because of the damage and infarction. Here you can see the infarct area, the necrotic myocardial fiber that they have no nuclei. But here you can see the normal myocardial fiber that all of them have normal and wire nuclei. Okay, that's it.
मैडम तो ये साबिर हुसैन का S23 FE Samsung से रिकॉर्ड किया गया है।
Two slides of necrosis, tumoral necrosis and fat necrosis. I explain about
दोबारा करना मैं बंद करता हूँ।